Dr. Alfred Karagu. I am the Chief Executive Officer of the National Cancer Institute of Kenya. This is a government agency that is charged with the responsibility of providing oversight and regulation for cancer prevention and control activities in the country. And we are happy to be here in Kakamega County, meeting with the Department of Health. And our visit here was largely to help them or create awareness around our mandate as the National Cancer Institute, but more importantly also get a chance to disseminate, get a chance to disseminate some various policy documents. The Institute is actually established through an act of parliament, the Cancer Prevention and Control Act of 2012. So we really wanted the Department of Health to understand why the act came into being, what provisions are there in the act, and how they can use the act to improve services within the county in terms of cancer care. We also had a number of policy documents that have been developed in collaboration with the Ministry of Health. We have the Kenya policy, the Kenya Cancer Policy that was launched sometime this year. Actually, it was launched in July this year by the Cabinet Secretary. So we had a chance to take the Department of Health through this policy and how they can also take advantage of it and implement it, because really the implementation of the policy is supposed to happen at the county level. As well, we also had a chance to take them through the guideline, the national guideline on setting up cancer management centers. As an institute, we have developed this document so that we have a very clear guideline on what is expected when you talk about a cancer treatment center. So this guideline really talks about issues around human resource, issues around infrastructure, issues around equipment. So we really wanted the County Department of Health to be aware of these minimum requirements, because one of our mandates is to accredit cancer centers, and we intend to, in the course of this financial year, we intend to go around all the cancer treatment centers so that we're able to classify and register them based on the set criteria that we have put in the guideline. But as well, we also really wanted a chance to really engage with them and understand what is happening in the county, how we can collaborate as a national government and them as a county government. And I would say that we've had some very fruitful discussions with the Department of Health. In terms of cancer in the country, cancer still remains as a major issue in this country, being the third leading cause of death. I think we see a lot of cancer cases being diagnosed. We estimate that about 48,000 new cases are diagnosed every year. And out of those, we see about 33,000 deaths. And it's important to note that the most common cancer that we see in this country is breast cancer. And it's symbolic that today is the 1st of October, which is the beginning of the Breast Cancer Awareness Month. This is something that is marked globally, and we really even try to time some of this engagement with the counties so that we also create awareness about the need to prioritize activities around preventing cancer. And there's no more important cancer in this country to prioritize than breast cancer, which is affecting most of our women. We estimate that about 6,000 new cancer cases of breast cancer are diagnosed every year. So really, one of the discussion points we had with the county is to see how they can start implementing activities that help them to reduce the cases of breast cancer in this county. In the country, we also see other cancers that are prevalent. We have cervical cancer, the second most common cancer. We have cancer of the esophagus as the third most common. We have prostate cancer among men as the fourth most common. And we have colorectal cancer as the fifth most common cancer. So really, we hope that because we are doing this around the country, engaging with the various departments of health, we hope that this engagement will help counties to really prioritize cancer. Because as I have alluded to in the statistics I've provided, we can see that cancer is really a big issue in this country. And we need, concerted efforts among all stakeholders, whether at the national level, county level, for us to be able to, to put our efforts together to do something about this burden. Of course, as the lead agency, we are working with stakeholders to, to implement a number of interventions. One of them is really what you are doing here, engaging with the departments of health so that they can prioritize cancer. We are also working with them so that we are able to build the capacity of our health workers, because we see that a good proportion of our cases are diagnosed late. And we think that one of the reasons for that is because our health workers are not well, capacitated to be able to detect these cancers early. So one of our key, intentions is really to work with counties, provide technical assistance to the counties so that their health workers, start being more empowered with information about cancer diagnosis. We also have a very wide mandate as an institute in terms of creating awareness, and that's why we are taking advantage of these opportunities, especially this Breast Cancer Awareness Month, to really ensure that Kenyans at large are aware about cancer. They need to know what are the risk factors, what they need to do to prevent themselves from cancer. But I would want to point out that even though there's a lot of activity going on about breast cancer, we must not forget that there are other cancers that we also need to talk about and start preventing. So that's our role, to make sure that we don't just get consumed by just one cancer. We must make sure that we talk about all cancers and think about what needs to be done. We are also very keen on putting together data so that we have accurate data that can help us in terms of resource allocation, in terms of helping the country and even counties to prioritize. So all these are things that we are doing, collaboratively with the county governments, with the national hospitals. We work very closely with Kenyatta National Hospital, Moi Teaching and Referral, Kenyatta University Teaching and Referral Hospital, because we want to have a common front in terms of managing cancer. I think we are happy that counties are taking up that responsibility of expanding services, because that is what is expected by the Cancer Control Act, that we expand access to services. So what that does to Kakamega County is that it helps them to be a center, a comprehensive cancer center that is able to provide the main services that are required for cancer management. And I think it's also important. I look at them as positioning themselves as a regional, referral center for maybe the other neighboring counties, and including neighboring countries like Uganda or maybe even Southern Sudan, so that now we can provide care for our people here in Kenya and also in the region. So that's something that we are happy to support them. Our biggest role is to make sure that even as they set up this comprehensive state-of-the-art center, then it has the minimum, it meets the minimum requirements or the standards that we would expect in terms of the right equipment, the right, staffing, the right infrastructure. So that is why that's how we come in to make sure that they adhere to those standards. I would say one of the biggest gaps is that is the gap between awareness and seeking healthcare. We see that I think one of the biggest responsibilities that health workers have is to empower the public with information so that the public can go out and get screened or get detected if they have some of these cancers like breast cancer. It's important to note that breast cancer is one of the cancers that are screenable. You can actually detect breast cancer even before symptoms develop. And it's important that health workers, sensitize and empower the public with information so that people can take advantage of the resources that are available. In our discussions today with Kakamega, we know it was very clear that some of the services like the mammography machine here at the county referral hospital is still underutilized. So it's important for healthcare workers, even at the lower level, in the dispensaries, in the health centers, as they interact with mothers in the maternal child health clinic, in the outpatient setting. It's important for us to sort of push this message that even though you don't feel like you have any symptoms currently, it's important for you to just go and confirm that you actually have no disease. And since these services are available, so the biggest role that healthcare workers have is to really create demand for these services that are available within the country. Thank you.